Hello, are you suffering from a chronic disease that your doctors just have not found the right answer to give you the relief from your symptoms? If you're looking for answers, maybe you're just looking in the wrong place until right now. My name is Dr. Lonnie Herman, and in this video today I'm going to share with you about Mast Cell Activation Syndrome. Mast Cell Activation Syndrome. What is it and how it might be affecting your condition? And unless you can neutralize these activated mast cells, you may suffer with your condition for the rest of your life, unfortunately. So let's listen about Mast Cell Activation Syndrome and let's see what can be done to help you deactivate these mast cells and help you feel better. So what are mast cells? What happens when they become activated? How can they be affecting you? What symptoms they might be causing, in other words? And what can we actually do to neutralize these activated mast cells and help you recover? That's what we're going to be talking about in this video. Okay, so we're back. So mast cells are cells in your body that don't cause you any harm when they're working in harmony with you. The thing is, mast cells can actually, in a sense, become traitors to your body. When mast cells become activated, they actually start to hurt your body. That's right. You can have mast cells that are not hurting you, and you can have activated mast cells that become like a traitor that then begin to hurt you. How do they hurt you? And why would they become activated? That's what we're going to talk about right now. So, activated mast cells release certain chemicals or substances, mediators, into the tissues in our body. And this can happen in any tissue, in any part of your body. These activated mast cells can become activated in your brain, in a part of the brain that controls movement of the arm and the hand. Maybe they're linked to a Parkinson's disease. These activated mast cells can occur in your thyroid, diseasing your thyroid and cause an autoimmune Hashimoto's, thyroiditis, or Graves' disease condition. These activated mast cells can occur in the pancreas. They can be connected to diabetes, both type 1 and type 2 diabetes. They can exist in the stomach and cause a constant nausea or vomiting syndrome of the person. These activated mast cells can exist in the sinus cavities and cause chronic sinus congestion issues. These activated mast cells can exist in the bone marrow, leading to chronic anemia. These activated mast cells can exist in the lungs and lead to asthma or chronic bronchitis. These activated mast cells may exist in a female's reproductive tissues, leading to a painful syndrome like endometriosis, or maybe not endometriosis, but with horrible premenstrual syndrome symptoms. These activated mast cells can exist in your lymph, in your muscles, in any organ, and in any blood vessel in your body. These activated mast cells release histamines, which create inflammation and congestion. They also release certain mediators, a part of the immune system, like cytokines, and they're dealing with different parts of the immune system that will actually lead to further inflammation and degeneration of the tissue. What if they exist in a part of the brain that controls your memory, where dementia can happen? They can exist anywhere. Why would they exist? Why would they become activated and become traitors to your tissues? One reason is from chronic infection in the body. These mast cells become triggered to become activated and become traitors to the body, creating inflammation because of infection in the body. So as if the infection was not bad enough, let's say you had a viral infection like COVID, or influenza, or Epstein-Barr virus, or the measles. These infections that are harming you will also be enough to trigger these mast cells to become activated mast cells, which can then further the inflammation for months and years to come. You can have infections like streptococcus bacteria, strep infection, like a strep throat, that can activate mast cells, which can then further harm your body and create other inflammation, even if the strep infection is gone from the throat. You can have candida infection that can activate these mast cells. And then the activated mast cells will cause more candida growth because the candida is trying to get rid of the activated mast cell, which creates more of this fungal growth in the body. It's a perpetual cycle. You can have mold infections that create activated mast cells. You can have parasitic infections that create activated mast cells. You can have chemical toxin you can absorb toxins in your body, whether it's from cigarette smoke, from Roundup weed killer that's been sprayed on your foods for the past 20 plus years of your life, arsenic that came from the water or the soil that you got your food from, injections from vaccines, dental anesthetics, and other chemicals for surgical procedures that are put into your body can cause enough of a toxic level in your body that can activate these mast cells. And then these activated mast cells start to wreak havoc in your body. We're going to get into in just a moment about what to do about these and what I do in my clinic to help people to deactivate these, to neutralize these activated mast cells. But before we get there, there's one more link that I'm going to tell you that I've discovered in my work, which is very unique. And you can learn more about my work on my website. I'll put the link down here to my website here, drlonnieherman.com. And before I tell you about the final piece of the puzzle that I've discovered, that is most likely the link to what we call, or what medicine is called, idiopathic Mast Cell Activation Syndrome. Idiopathic means they don't know why it happens. Well, I'm going to tell you why in just a moment. When you go to my website, the first thing you may see is there's a page that comes up on my website which you can enter your name and email address so you can download my free ebook. And this book I will describe how you can actually reverse these supposedly incurable diseases by getting rid of the causes of the condition. So if you see by my side here, the picture of my ebook, and you can download that for free when you go to my website. Now inside my free ebook about how you can reverse your chronic disease naturally with quantum medicine protocols, quantum energized medicine protocols really, there is a page in my website that's found in a link in this ebook about my unique quantum food sensitivity assessment that I perform in my clinic. You deserve to understand that certain foods can be triggering, even organic food, even something that seems to be healthy. Organic foods can trigger inflammation responses in your body because of certain hidden infections or toxins in tissues, and because of activated mast cells in tissues. It's not the food that's causing the problem, it's the infection or the toxin or the activated mast cell that's in the organ that's making you stressed by the food, that can lead to a headache after you eat a tomato, or that can lead to back pain after drinking, let's say, Coca-Cola, or something to the effect, okay? So I get more into detail about some incredible recoveries from certain chronic diseases, chronic illnesses, on this food sensitivity page on my website. Further through my book, you'll see there is a page about my unique quantum dental resonance examination. And on my page here in my website, you'll understand about the in-depth discussion, I should say, about the unique exam findings I discover with infections and toxins that are hidden under dental crowns, infections that are painless, that are in the jawbone, leading to disease in the brain and the body. There are toxins that could be under certain crowns, caps, like mercury fillings that are toxic to the body, which can also activate these mast cells. Okay, so there's a lot of findings that I've discovered in more than 10 years of very intense research about dental work and the connection to disease in the body. I think you really would benefit if you went to that dental page on my website as well. And one more point before I tell you about what I believe is causing the idiopathic mast cell activation syndrome. On the very last page of my book, there's a link that you can click on, and it will bring you to a private page of my website where I put I'll show you the screen, what it looks like here in the website, There's a 42-minute video that I created where I describe my background, all of the postgraduate schooling I went through for more than 10 years in postgraduate study, as well as about 20 minutes of discussion where I give you some detailed insight into the science, into the method, into the type of work that I'm doing to help people recover from chronic diseases. And I'm getting people well from asthma, rheumatoid arthritis, Hashimoto's thyroiditis, diabetes, chronic pain syndromes in the body like CRPS, and peripheral neuropathy, small fiber neuropathy, people with different digestive disorders, and the list goes on. We've got many different conditions, even multiple sclerosis and lupus, getting people well from these conditions. And I've got proof of before and after videos, before and after pictures of these patients, before and after discussions with these patients. So it really is mind-blowing. Okay? You'll benefit from all that information if you want to get well from your chronic disease and stop the madness. So now about idiopathic mast cell activation syndrome. One thing I learned years ago from one of my great mentors, one of several mentors I've had, is that traumas in the body can actually cause certain disease patterns to develop in the body. And a trauma, whether it was a broken bone, or maybe you fell and hit your head when you were 2 years old, or maybe you got into a fight and somebody had punched you hard in the face, or some other type of trauma, slammed your fingers in the door. There's many different traumas that can occur in your body, even getting an injection in the arm to draw blood, or pulling a tooth, teething, even cutting the umbilical cord when a baby is born is a trauma to the body. So these traumas can ripple energy distortion to different parts of your body. Let me prove my point in this picture that I'm going to paint for you. If you look in a pool of water and the water is not moving, the water looks like a mirror. You can see your reflection perfectly in there. Now, if you take a pebble and drop the pebble in the water, what happens to that water that was once still? It ripples out in every direction, 360 degrees from that pebble you dropped in the water. And it's going to go as far as that energy distortion will carry that ripple through the water. Once the water maybe hits up to the end of the pool, the wall against the pool, it's going to bounce back and ripple back in other directions, backwards into the pool. Now, what if you take a bigger rock and throw it in that water? A bigger trauma to the body, whether it's a concussion, maybe you had a head trauma, maybe you broke your nose, something else, maybe you broke a leg. Maybe there was an open heart surgery where they had to open your chest, and that created a trauma, and that created a ripple effect. You drop a big rock in that pool, it's going to be a much bigger, a bigger ripple effect. Now, if you think of like in Alaska, where there's calving of a glacier and a big piece of ice comes off a glacier and drops into that water, there's going to be a much bigger wave coming out of that water that's going to carry that energy, that ripple effect for a lot longer, a lot bigger than just a pebble in the water. Well, what about a tsunami, where there's an earthquake under the water and there's a big ripple? A major tsunami can develop and create a lot of destruction. So let's think about your body. Go back to when you were first born and they cut the umbilical cord. And that trauma to the body, like a drop in the water, created a ripple effect, and it can immediately create a ripple effect that went up to, let's say, a part of your brain where reading and comprehension takes place, the frontal lobe of your brain. And it ripples up there and it bounces off the skull and it goes into that frontal lobe and activates mast cells in that frontal lobe of your brain. What's going to happen over time when the activated mast cells are releasing certain harmful inflammatory chemicals into the frontal lobe of your brain is that frontal lobe is not going to be able to perform properly. Maybe there is a problem with a child in school with reading or arithmetic because these activated mast cells are affecting that brain. And no, there is no laboratory that you can run that's going to find them. I have a unique system in my clinic. Again, go back and look at my book, watch the video that I pointed you to on my website to learn about my system. There's a way to figure all this out, and I'll show you a brief video in a few moments about how we can use the energy of the activated mast cell to neutralize it, to have that part of the brain, for example, the frontal lobe, to function better. Okay? What if when they cut the umbilical cord when you were a baby, it actually rippled up to, let's say, the pancreas, and all of a sudden at 1 year old, the baby gets diabetes? It's possible there are activated mast cells in the pancreas causing destruction of the islet cells where insulin is made. Is that possible? Could that be happening? It sure can. What if they cut the umbilical cord and the ripple effect went to the intestines and it took 10 years to build up the amount of activation of mast cells that caused destruction in the intestines to lead to Crohn's or celiac disease? Is it possible? Sure. What if you had a trauma where you broke your leg when you were 10 years old and it rippled up to the right kidney in your body? And 20 years later, the activated mast cells in the right kidney have built up to such a degree and released all these mediators into the kidney that you've got high blood pressure, you've got kidney disease, maybe even they're putting you on dialysis because the kidney's not working well. Is that possible? Yes, it is. So understand that activated mast cells, when the number of them become great enough, they can start to destroy tissues and cause chronic ailments, chronic illnesses, diseases in the body like Parkinson's, like diabetes, like digestive issues like Crohn's or celiac, like constant bloating or irritable bowel syndrome. They can lead to respiratory problems like asthma. They can lead to glandular problems like thyroid disease, like adrenal complications leading to chronic fatigue syndrome. They can lead to brain fog. They can lead to pain syndromes. The muscles can always hurt, like fibromyalgia. Maybe there's activated mast cells in the muscles and affecting the whole nervous system. It is totally possible. Totally possible. In one of the recent protocols for about a 9-year-old young girl who's diabetic type 1 for over 2 years, her blood sugars were always above a 400. No matter how much insulin the parents and the doctors recommend the parents gave the daughter. I found with her, using my trauma analysis with her whole body, I found that she had activated mast cells in her blood, activated mast cells affecting her pancreas, activated mast cells affecting her islet cells in the pancreas that make insulin, activated mast cells affecting the hypothalamus of the brain, which is the part of the brain that controls hormone production, that regulates the pancreas, that regulates the liver, that regulates the kidneys and many other systems of your body. When the parents gave her the first energized drop that we made for her to deactivate these mast cells, these activated mast cells from her bloodstream, not directly to the pancreas, not directly to the hypothalamus, what was amazing was she had a 400 blood sugar the night before, no change in the insulin use, no change in the food that was provided her. The next morning it was still at the 400. The father gave her the remedy, the energized liquid drop that's to cancel out the frequency. I'll show you in just a second how it works, of the activated mast cell in the blood. And later that day, that was a Friday afternoon or Friday evening, I got a message from this father that the 400 blood sugar dropped down to a 100. There was no change in diet, no change in insulin use. The next morning I got another message. The blood sugar dropped down to about a 50, an urgent low. For the first time in 2 years of being diabetic, it dropped down to an urgent low. No change in insulin, no change in diet brought her there. Just deactivating these mast cells, these activated mast cells that were in her blood. Pretty amazing. So there are other people where we're using the same type of analysis for traumas on the body, where brain fog is disappearing pretty rapidly, energy is increasing pretty rapidly, pain in the body is decreasing rapidly by deactivating these activated mast cells, by neutralizing them. Let me show you this brief video. It's about 30 seconds in length. And in this video, which is under a microscope, you're going to see there is a cell that they're going to focus on, this one cell, which is infected with a parasitic infection with a frequency of 1150 hertz. So you'll notice this. When they bombard that frequency 1150 with the same, like cures like, when they bombard the frequency with its own frequency of that parasite that's in that cell is destroyed. All the other cells swimming around in the background in the fluid, they're not damaged at all. Only that parasitic infected cell is destroyed. When we can use the same frequency to neutralize the frequency of that organism that's in the cell, or the chemical in that cell, or these activated mast cells, We can get rid of them. We can neutralize. We can help the body evacuate the harmful agent that's inside the body. So I'm going to tell you right now, that's my close for this discussion, but I'm going to let you know I'm coming up with a series about different diseases, about these Mast Cell Activation Syndrome with these different diseases. For rheumatoid arthritis, for endometriosis, for chronic vomiting problems, for asthma, for neuropathy, for headaches, for diabetes, for Parkinson's disease, for dementia, and there's others. So stay tuned for the rest of the series. They'll be coming up very soon. And right now, if you're ready, after you look at my website, read my free book, look at some of the testimonials on my website, real people giving real good positive comments. When people can get better, they do leave comments. Some people are a bit shy, but a lot of people do get on camera with me and they're willing to share their incredible recovery. And there's a lot of those that are shared on my website and on my YouTube channel. I look forward to helping you. If you're ready now to make an appointment with me and get your life back in order, because you can have rapid restoration of your health with this type of work I'm offering you, you can call my clinic at 954-370-3100. You can go to my website. You can make your appointment right there. You can send an email. I'll put the email address to my clinic at drlonnieherman.com. You can email my clinic assistant, who's happy to help you get your appointment set with me. I'm going to put up a link here as well to the frequently asked questions on my website. And these are common, like how much does it cost for care? How long do I have to come into your clinic for? How long is it common protocol? What's the airport that's near your clinic? Most of the people who come to my clinic are from other states within the United States. And many people, prior to the coronavirus, people were flying in from many other countries. Some are still able to get into the United States. Many are not right now able to get in. Hopefully we'll be at the near end of this situation, but many people are traveling to my clinic from other states in the U.S. The majority of people who visit my clinic are coming from other states. So there's a local airport and the hotels and all that's discussed on this frequently asked questions page. The care is an investment in yourself. The cost is an investment in yourself. This is not covered by regular health insurance. They don't recognize the kind of work that I'm offering. This will be your responsibility. I understand it'd be a lot better if insurance covered. I do understand that, but they just don't recognize this work and they're not going to cover it. So it is an investment in yourself, and you can get better. It is time to put an end to your disease. It's time to stop your chronic symptoms and get relief finally and move on in life. I'm here to help you do that. I look forward to helping you. See you soon.